Good afternoon, you guys. My name is Jessica Cesare, and I'm doing my video presentation on the Japan healthcare system. So let us start. Visiting doctors is very common in Japan because of the type of healthcare system they have. They actually visit 4 times as often as we would in the United States. Japan has a universal healthcare system. So if you are a Japanese citizen or a non-Japanese citizen living in Japan for more than a year, you qualify for either health or private insurance. If you're a non-Japanese citizen, you have to provide your alien registration card in order to apply for health insurance in Japan. There are two types of public insurances. First type is called social health insurance, also known as the employment-based health insurance. So this insurance usually applies to people who work in private schools, national or local government, or any other employer that may provide it. The second type of health insurance is called the national health insurance, also known as Kokumen Kenko Hoken. So this is for people who are not covered by the employee's health insurance. So for example, those who are self-employed, so those who may have their own business, students, or people working in small companies would actually qualify for this health insurance. So what do they cover? According to internations.org, both national health insurance and social covers between 70 to 90% of cost of medical appointments or procedures. This includes well checkups, preventative care, prescription medicine, hospital stays, birth and perinatal care, and therapy of any kind. The percentage, however, depends on how old you are on age. So for infants, it covers 80% of medical costs. For school age children to 69 years of age, they will have 70% of costs covered, and for 70-year-olds to 74-year-olds, they have 90% of their costs covered. So even though the percentage are high, there are actually still individuals who have to take out private insurances for treatments that are not covered. Also, private insurance is popular among tourists and foreigners who visit Japan and only plan to stay for a couple months. And because of health insurance being required in Japan, most hospitals and clinics do not accept international healthcare plans. According to internations.org, if you are in Japan for more than 90 days and you do not have insurance, because you have not applied for it, you will be charged a penalty. It's actually a legal requirement for you to be covered by either public or private insurance over 20 years of age. So let's move on to the cost. Healthcare costs in Japan may differ depending on the medical treatment you are getting. It also depends on the type of physician you see and the length of time spent with the physician. However, in general, you can expect to pay between 5,000 to 10,000 yen, which is between $45 to $90 US. Um, and for a hospital visit, you can expect to pay 10,000 to 15 yen for a hospital visit, which is $90 to $140 USD. These prices can also go up to $180 to $460 if you do not have insurance. Um, According to internationalstudentinsurance.com, the employment health insurance is paid for through your salary check. So if this insurance plan, the monthly premium is taken out of your salary. So both you and your employer will contribute to the monthly premiums that you pay. Your employer's insurance company also decides the percentage of your salary. So it can be between 5 to 10%, but usually in Japan it's around 5%. For the national healthcare insurance plan, the cost varies according to where you stay, so where you reside. So it's also based on your previous year's income and based on the size of your family. So to conclude, Japan has a universal healthcare system. It's mandatory that everyone has to join either a public insurance plan through their employer or government or a private insurance plan. And I just want to read this quote before we end. Our nation has achieved an average life expectancy and healthcare standards that are at the world's top levels. And this was from the Health ministry in Japan. Here is my works cited page. Thank you for listening.